Illnesses, especially rare and chronic diseases, often evoke feelings of indescribable fear and helplessness. We need more research, more allies, and more advocates, and I consider myself to be a soldier in this fight. Welcome to Chronic Illnesses and Advocacy. Today we have Dr. Heidi Kummer. Previously, she was an anesthesiologist, an intensive care physician, a bioethicist, a physician leader on professional society boards, and an entrepreneur managing a startup. But in her words, her most important role to date has been an advocate for seriously ill or dying parents, close friends, or family members. Thank you so much for joining us.
Thank you very much for having me. I'm really thrilled to be here.
So could you speak a bit about your career as an anesthesiologist and intensive care physician?
Absolutely. It was a bit of a circuitous route getting there. I knew fairly early on that I wanted to do something in medicine or become a physician. My parents had immigrated from Germany to the US in the late 50s, and my brother and I were born here in this country. And unfortunately, our father died of an osteosarcoma, of a bone cancer, fairly early on. I was 8. And we were not really allowed to see him in the hospital. So only if he was well enough to come out to the common room or visiting room, which was the smoking room essentially, was when or how we could see him. And he got chemotherapy and went through. He had an awful death. Let's just put it that way. He had a really awful death. And I mean, already at age 8, you sort of figure out there's got to be a better way to do this. So from then on, I was sort of predestined to want to go into medicine, and once in medicine, sort of focus on the end of life care or critically ill patients. So my mother then moved to Germany, went back to Germany after her husband died, with us. And so I actually had all my schooling from 4th grade on through medical school in Germany. But I knew I wanted to come back to the States at some point. And so all of the clinical rotations that were necessary and were required, I completed in hospitals in the US, including here at Boston University. I spent 2 months one summer doing clinical rotations here, and I was offered a surgical position. And so I came back to the US in 1986 and started in surgery. I was fortunate enough to import my husband, who was already a board certified trauma surgeon at the time in Germany. But once he was here, they made it pretty clear that they'd make him retrain in surgery if he wanted to practice here. And so we figured out that maybe both of us being in surgical residencies was not such a great idea. And since I wanted to do critical care medicine, I switched from surgery into anesthesiology because that also allowed me to do critical care. And I must tell you, I never looked back. I loved what I was doing. It's a phenomenal specialty, very challenging, very rewarding in many aspects. And that's kind of how I wound up doing anesthesia and critical care.
So how did your journey in advocacy begin?
Well, that was something where I left clinical practice because of some changes at the hospital that I was working in, and I went back to school and got my master's of public health, which was also great fun. I mean, it was I think everybody should have the opportunity to go back to school in their 40s because it was just it was great. I really, really enjoyed it. I was after that I was managing a startup, and I had been advocating for friends and family for decades, right? But in 2018, I discovered that there was a new board certification for patient and healthcare advocacy, and that made sense to me because although I had all these other degrees, if I am there advocating for a client, because they're not my patient, I'm not there as a physician, right? And I'm not there as a public health specialist. I'm there as an advocate. And having the requisite certification that goes with that profession, if you will, was important to me. And it professionalizes it vis-a-vis the other professionals that we're interacting with. And 2018 was in fact the first year that the Patient Advocate Certification Board offered the board certification. So I became board certified and started my own independent advocacy practice in Boston.
And what would you say is the most rewarding part of being an advocate?
And honestly, the most rewarding part is when my clients don't need me anymore, because it means that we've managed to find the therapies that they needed and the specialists that they needed, and that they had gained the confidence, and, if you will, also health literacy to advocate for themselves. So unfortunately, I also, of course, have a lot of clients who have cancer or have, end of life, as I mentioned before, is something that I am very interested in and I do work in. And so, not all of some of my clients, unfortunately, die because that's the course of their disease. But knowing that they had the best course that I could help them with is always very, very satisfying.
And what would you say has been a challenge you've managed to work through while advocating for a patient?
Oh, I'd say one of the most difficult scenarios was getting a call from a family here in the Northeast whose adult daughter, who was in Florida at the time, had suddenly become practically quadriplegic. I mean, she went from being completely normal to not being able to move any of her limbs the next day. And this was at the height of COVID. It sounded like she was misdiagnosed, and we were trying to transfer her up here, get another opinion, et cetera, all, as I said, in the height of COVID. And that was pretty challenging, but we managed, and she's actually doing great, which is really wonderful.
That is good to
All
hear.
more wonderful. Yeah.
What would you say is the most or some of the most important traits to possess while being an advocate in order to support your patients?
Well, my company is called 3C, which stands for competence, compassion, and care. And I think those are certainly three very important attributes. One of the most important things we do that I believe really helps our clients is we listen. Right, we listen to them, and that's, as we all have had our doctor's visits that are 90 seconds long, or within the first 7 seconds we're interrupted. They might even ask us a question, but never really listen to what we have to say. So just the process of listening to them and really trying to ascertain the whole picture and being able to put the puzzle pieces together and have a clearer picture of what's going on, that's huge. That's I'd say at least 50% of what we do, sometimes more. And then making sure that communicating with all the players and making sure that everybody's on the same page, and very, very importantly, making sure that clients and patients understand their options, right? And especially also understand that one option is not to follow prescribed therapy, right? Especially when you're talking about cancer and chemotherapy and advanced stage, that you have an option for supportive care. You don't have to go the really strong route. And then finally, I'd say one of the most important, I like to say, tools in our toolbox is our Rolodex. So, you're probably too young to even know what a Rolodex is anymore, but because everybody just has things in their phone, but I would never profess to have all the answers, but I probably know somebody who does. So if there's something I don't know, I have just a huge network of people, and it's physician colleagues, it's advocacy colleagues, it's all over the US certainly, but also the world, that I can reach out to for answers. So that's, and I'm very lucky. I practice in Boston, in the Northeast, and one thing that COVID sort of did, if you will, and a slight silver lining, it made the acceptance of virtual care and virtual visits a lot more common. And so it's easier for us. I have clients all over the States and actually also in Germany. So, being able to attend visits by Zoom or on the phone, it has been really helpful for us, and allowing us to be there for people who aren't geographically in the same area.
If there was a circumstance where your clients were kind of disagreeing with their physician's plan for their treatment, how exactly would you go about solving that?
Well, whenever there's a disagreement, and usually there's a lot of disappointment or anger, what have you. I mean, one of the most important things to remember is that you have to focus on the intention, right? And not necessarily the execution. So neither the physician nor the patient has a bad outcome or evil in mind, right? They both mean well. And so sometimes it's about, again, listening. I mean, more often than not, it's really about listening and making sure that the two parties actually hear each other and understand. More often than not, it has to do with someone misinterpreting the goals of care, or honestly, never having asked about the goals of care, right? So one of the things that I'm somewhat passionate about is this idea of futility at the end of life, right? If you continue, I mean, we can keep somebody on life support forever in this country. But, is that a wise thing? And that's why it's so important for people to have these conversations about what would they want their health proxy or someone to do if they were in such a situation. And futility is always, it's connected to something. It may be futile to say, oh, we're going to keep them alive forever, versus we're going to keep someone on life support until their son arrives from overseas. That's not futile. That makes sense. So being able to identify what the goals of care are, again, I'll use a cancer patient as an example. If the disease is advanced and they are not interested in spending the remaining months that they have with nausea, with being just incredibly tired, et cetera, with all the side effects that you can have from chemo and radiation, et cetera, and instead would like supportive care, versus a physician who's just thinking of, this is the regimen that we have for this particular cancer that you're suffering from, they're not talking to each other, or they're not hearing each other. And so making sure that, my allegiance, and that's the nice thing about being an independent patient advocate, my allegiance is solely to the client. I don't work for the hospital. I don't work for the insurance company. I work for and with the client. So making sure that their views, their goals of care are acknowledged and, ideally acted upon.
And what advice would you give someone who's kind of new in this area of advocacy?
Well, there are some terrific groups out there now, and one of the things that anyone who's interested in advocacy learns very quickly is that you can put a whole bunch of strangers in a room together, and if they're advocates of some sort, you will all click, because advocates share the empathy gene, right? Most of us come to this field because of bad experiences in healthcare. And it's either a bad experience that we ourselves have been through, or we've been through with our parents or a sibling or a child. That is really the main reason people wind up going into healthcare advocacy. And so finding like-minded people in your area. There's a National Association of Healthcare Advocates, NAC. There are regional groups. There are directories where you can, gnanow.org is a directory where you can find out who the advocates are in your area, and speak with them, and get some. There's wonderful mentorship going on for people who are interested. There's a whole section of young adults who are especially again in the young adult cancer communities, also in the mental health and behavioral health space. There are all sorts of advocacy groups, so there are several that one could get involved in or look into.
Well, thank you so much for your time. It's very insightful what you had to say.
Well, you're very, very welcome, Lakshmi. Feel free to reach out anytime. We're a very, I'd say, very generous group of professionals who love what we do and just really want to help people.
All right. Thank you. Take care.
You too. All the best. Thanks for having me.
Thank you.